Tools and strategies used in the healthcare field include SBAR communication, briefs, huddles, and debriefs, intershift report, and I-shaped communication. And in the next slide, we will briefly discuss CUSWORDS and I pass the baton. SBAR is an acronym used to discuss situation, background, assessment, and recommendations. Situation discusses what is going on with the patient. Background, the clinical background. Why is the patient here and what is their medical history? Assessment includes a systematic review of systems, and lastly, making recommendations for the oncoming nurse, discussing the plan of care and what to follow up on. Briefs, huddles, and debriefs are three techniques used to promote teamwork. Briefs are defined as short planning sessions before an event and usually discusses who is on the team, assigning roles and responsibilities, and establishing expectations. Examples of when and where this might be used is in the emergency department before a trauma patient arrives, or during a code blue. You might also see this being used when your hospital knows that the Joint Commission is due for a visit. Huddles are short, less formal, and usually unplanned, and usually occur at the change of shift. However, they are sometimes needed impromptu. Debriefs is defined as feedback or informal exchange of information that occurs shortly after an event. For example, we had a particularly challenging code blue in our ICU involving multiple team members. A pregnant woman in her 20s at 32 weeks gestational age was complaining of chest pain and coded. CPR was started, and to ensure best patient outcomes, the baby had to be delivered within 5 minutes of starting CPR. So we had to call a code blue and a code white to mobilize the appropriate teams and to save both patients. Multiple areas of effectiveness and performance improvement existed in this case. Debriefing after this event was imperative to identify what went well, what did not go so well, and what could be done in the future to improve performance. Both mom and baby survived and are doing well. The I-shaped tool was created to promote patient-centered and family-centered healthcare. This tool is used at the bedside so that the patient is involved in report. I-shaped is an acronym similar to SBAR, and its components are introduction, story, history, assessment, plan, error, prevention, and dialogue.